Providing the Bellin experience through patient and family-centered care, listening and honoring patient perspectives and choices, and collaboratively working with the healthcare team. These are all reflective of the value of service, and these traits are front and center for the palliative care providers, this year's recipients of the Bellin Values in Practice Team Award for Service. Providing a positive experience when a patient is faced with a life-threatening diagnosis can be difficult. But for palliative care providers, it's something they have mastered, and the results are positive for patients, coworkers, and Bellin Health.
I describe palliative care to patients and families as care that focuses on easing suffering. Okay, and suffering can be emotional, psychological, physical, spiritual, financial, and really can be offered when an illness that's going to be chronic or life-threatening is diagnosed.
Our job is to see patients, work with patients and families in often difficult situations to help them make decisions and achieve a sense of comfort and peace.
I see the care that they provide to the patients and how much time and how much input they put into the patient's care plans.
There are a lot of examples to think of where we really try to demonstrate service. There have been times when we've worked hard to make sure people can achieve a bucket list item. We've tried hard to give them the tools and the resources to provide legacy items for grandchildren or children.
We have a collegial team, and so many times if we have a challenging situation, we run ideas past each other. We'll often call each other for what would you do about this or how would you approach this. So having that kind of support is really helpful.
The work that we do can impact the system here by giving other providers a sounding board to talk about what's going on with a patient, to put our heads together to find a better way to provide care and a better way to bring quality of life. We understand that in many cases life can be short, and we need to embrace that, and we also need to embrace the joy and the life of the person who's being affected at that time.
Thank you, Dr. James, Lynn, and Helen, for always going above and beyond for our patients.
I am so fortunate to work with a fantastic team. Helen and Lynn are not just colleagues, they're friends and almost like sisters that I never had. I also want to say thank you to Jenny and to Annie for their support in nominating us. There are a lot of deserving people out there. Not quite sure that we deserve it any more than anybody else, but you guys are awesome. Thank you.